Good evening. Welcome to Wednesday Night Study Live, where we gather to prepare to pass our addiction counselor exams. Good evening, everyone. Good evening. Come on in. Come on in. Tonight is our very first 3 hour intensive session. We'll be studying from 6 p.m. to 9 p.m. I'm so excited. Let me get my camera together. All right. For those of you who are new, I'm Letitia, a licensed professional counselor and licensed substance abuse treatment professional. I'm a therapist and mental health educator. Over here on Tisha Talks Mental Wellness, I provide substance use and mental health education and addiction exam study prep. So if you're here and you're preparing for any addiction counselor exam or course, we master general foundational topics related to addiction counseling to help you prepare for your exam. So again, welcome. Let me check the chat. See if you guys are coming in, if you can hear me, if everything looks good. Getting ready. Hello to the playback. If you are watching this and you couldn't join us live, no worries. It's okay. At least you're watching now. So make sure if you are new, put your the test you're preparing for and what state you're in the comments so you can introduce yourself. Welcome, study partner. And if you are returning study partner, hi, put in the comments what you're working on, like what topics are difficult for you, what topics are challenging, what topics you want to see a video on. And after this month, I'll go back to recording pre-recorded videos. So for the entire month of August, we'll meet every Wednesday for an intensive like this. So get your paper, your pen together so you can jot down anything that stands out to you. Okay, where is all of my... Okay, I can't find the... Okay, let me make sure we together, y'all. There you are. Good evening, everyone. All right. If you guys could put a 1 in the chat if you can hear me clearly so I can go ahead and get started. Come on in, come on in. Make sure you are liking the video and that you are subscribed to the channel. That helps us reach other study partners. It puts us in the algorithm. Oh, sorry, guys. All right, let's rock and roll. Welcome to our Addiction Counselor Exam Study Group, everyone. Tonight we'll be completing 3 separate topics. Hour 1 will review screening questions. Hour 2 will review assessment questions. And hour 3 will review treatment planning questions. So it's the same format. We're just doing it for a longer period of time. I'll read the question and the answers. I'll pause, give you an opportunity to process which answer you want to choose. You put your answer, your letter in the chat, and then I reveal the answer and then I explain. There'll be explanations for both incorrect and correct answers. And then at the end, we can do Q&As. We'll do a brief Q&A after each hour just to give ourselves a chance to breathe, give people who are just coming in a time to drop in. And then at the end at 9, well, closer to maybe like between 8:50 and 9, we can do the end of the stream Q&A. All right. Okay, let me see if my screen, okay. Screen looks good. A few housekeeping items. The first reminder is your number one resource for your exam prep is going to be your exam website. We are all studying together, but some of us are studying for different exams. So, for example, if your exam is the ADC or the AADC, your number one study resource or reference for your test is going to be the ICNRC website. So, make sure that is your number one reference in terms of how your test is set up, what questions they'll be asking, topics and domains, and such. 2, the way we study over here is through multiple choice questions. Sometimes it'll be kind of scenario based, but most of the time it's just a straightforward question with multiple choice answers. That doesn't mean your test is going to be set up that way. So again, you use this learning community as a resource, but it doesn't mean your test is going to be set up that way. We're just mastering the topics. And the third reminder, because these are my top 3 questions, you can get additional study resources at my Stan store. I'll make sure I put the link in the chat. The link is also in the description. I have free resources, and then I have 2 very affordably priced resources. One is a checklist, and it's about 67 pages. It's a detailed checklist if you are a person who struggles with organizing how to study and what to study. And then I have a practice test. It's a foundational practice test. You're supposed to use it to practice being in a quiet setting, so you can get used to, you can practice for your exams, and also to master foundational topics. So those are the most frequently asked questions. I hope I was able to clear up answers for you. Okay, let's get started, everyone. So, welcome to hour 1 of our 3-hour intensive. I hope everyone is well. Again, hello to the playback. If you're watching on the playback, get your pencil and pen out. That way you can take notes when I do the explanations. This not only reinforces what you learn, it helps you layer and stack your study time. So you'll be learning about whatever topic we're talking about, but you also get a chance to reinforce other knowledge through the incorrect answers and through the explanations. All right, so hour 1, we're going to be talking about screenings. Screening is a very important part of the addiction counseling process. As professionals, we're always going to be required to do screenings first, because this points us in the direction of what's next for the client and what services they might need. So our screening questions tonight will be based on substance use specific screening tools, whether it be substance use screening or mental health screening, maybe withdrawal screenings, where the screening happens in the counseling process. If you are not on my email list, you can join my email list by downloading the free resource. If you've already downloaded my free resource and you are not receiving emails from me, you can email me directly and request that you be put on my email list. You can get this graphic, and then I also post the graphic on our community posts as well. All right, what you need to know about screenings. You need to understand the purpose of screenings. And you need to understand that screenings are used to identify whether a client may have a substance use disorder, a mental health concern, or both, or if they need further evaluation. Think of it as a quick check to determine whether additional assessment is needed. Secondly, screening is brief and it helps identify risk. So you need to understand the difference between a screening and an assessment. An assessment is more comprehensive, and screenings does not include a diagnosis or determines the severity. It's brief and it's meant to identify if further steps need to be taken or if the client is ready for intake into the service. Also, you don't need to memorize every screening tool, but you need to know like the core, like maybe the most popular 5 or 10, and I'll even say 5 substance use related screenings and 5 mental health related screenings. Because you can do mental health screenings because it's not an assessment. Usually it's just a questionnaire. But I would prepare as an addiction counselor to see lots of clients with co-occurring issues. So be familiar with both substance use related screenings and mental health screenings. And lastly, on the exam, make sure you understand what the specific screening does and what the next steps will be for children or adolescents, and know what it's actually screening for: drugs, alcohol, both, or a mental health condition. Remember, you should understand how to administer the screening, like what kind of questions are asked. Are there specific questions? Because some screenings are questionnaires where you ask specific questions that are laid out for you. You also need to be able to identify the risk and determine the level of need of the client after you do the screening. And lastly, under documentation, you need to be able to document the results of the screening, and you need to be able to clinically explain what the next steps are for a client. And that goes into like level of care. Okay, let me check the chat. All right, I see that I'm clear to go. Let's get started on the questions. Question 1. A 42-year-old client presents for an initial appointment after being referred by his primary care provider due to concerns about alcohol use. The client denies having a substance use disorder but reports drinking a few beers most nights. The counselor wants to quickly determine whether the client's alcohol use may warrant further evaluation. Which screening tool is most appropriate to administer first? A. Audit. B. DAS-10. C. PHQ-9. Or D. ASI. Which screening tool is most appropriate to administer first? Okay, I see a lot of A's. The correct answer is A. The Alcohol Use Disorder Identification Test is specifically designed to screen for hazardous and harmful alcohol use. It's brief, evidence-based, and it helps determine whether additional assessments are needed. Because the client's primary concern is alcohol use, the audit is the most appropriate screening tool for this situation. B is incorrect because the drug abuse screening test, DAS-10, screens for problems related to drug use rather than alcohol. Since the client's presenting concern involves alcohol, the DAS-10 would not be the most appropriate. C is incorrect because the PHQ-9 screens for symptoms of depression. And depression may occur with substance use disorders, but there's no information suggesting that depression is the primary reason for the client coming in. And D, The ASI, the Addiction Severity Index, is a comprehensive assessment used after a client has screened positive or when a full biopsychosocial evaluation is indicated. So it would not be the most appropriate in the screening process. Question 2. Which statement best describes the purpose of screening in addiction counseling? A. To collect information needed to establish a diagnosis and develop an individualized treatment plan. B. To identify individuals who may be at risk and determine whether further assessment is needed. C. To evaluate the severity of substance use and determine the most appropriate level of care. Or D. To monitor changes in client functioning and evaluate the effectiveness of treatment interventions. Which statement best describes the purpose of screening in addiction counseling? Okay. Please put a 1 in the chat if you can hear me clearly. Okay, we should be all set. The correct answer is B. To identify individuals who may be at risk and determine whether further assessment is needed. Screening is a brief process used to identify individuals who may be at risk for a substance use or co-occurring disorder, and it's used to determine whether additional assessment is needed. So the biggest thing to remember about screening is not every client or every person you screen will need treatment, or a higher level of treatment. So they may need education. They may need brief intervention. They may not need treatment at all. So that's what the screening is for. And you have to be able to comprehensively put together what you learn from the screening and document why or why not they need this particular level of care. A is incorrect because this answer describes a comprehensive assessment which gathers detailed information to support a diagnosis and treatment. C is incorrect because this answer describes placement and level of care determination, which occurs after an assessment. And D is incorrect because this is more ongoing treatment monitoring. So this happens after the assessment, diagnosis, and treatment and services has started. So the knowledge you need to know for these types of questions, you will need to understand the purpose of screening. You need to understand the difference between a screening and an assessment. And you need to understand how the addiction counseling process works, what order the different tasks we have to do go in. Related skills, you need to be able to differentiate between screening and assessment and determine the appropriate next step in the clinical process. Question 3. A 16-year-old client is referred for an evaluation after being caught using marijuana at school. The counselor wants to use a brief evidence-based screening tool designed specifically for adolescents to determine whether further assessment is needed. Which screening tool is the best choice? A, the Cage Aid. B, the DAS 10. C, Craft. Or D, Audit. Which screening tool would be the best choice? All right, see your answers. The correct answer is the Craft screening. This screening is a brief, evidence-based screening tool designed specifically for adolescents to identify alcohol and drug-related risk and determine whether further assessment is needed. I remember this, I just think of arts and crafts. Children, arts and crafts. Crafts is a screening for adolescents. Craft stands for car because a question in the screening asked, have you ever ridden in a car driven by someone, including yourself, who was high or has been using drugs? The R stands for relax. Do you ever use alcohol or drugs to relax or feel better about yourself or to fit in? The A stands for alone. Do you ever use alcohol or drugs while you're alone? The F stands for forget. Do you ever forget things while you use alcohol or drugs? And F is for friends and family. The question is, do your friends or family ever tell you that you should stop using or cut down on alcohol or drugs? And T is for trouble. Have you ever gotten into trouble while using alcohol or drugs? So this is just a brief few questions to give you an idea if the adolescent's use is problematic, if they need additional treatment or brief intervention. A is incorrect because the Cage Aid screens for alcohol and drug use, but it's used for adults. B is incorrect because the DAS 10 screens for problems related to drug use in adults, not specifically for an adolescent or teen. And D is incorrect because the audit is used to screen for problematic alcohol use in adults. So this type of question, you will need to know the purpose of the Craft screening or the purpose of the top 5 or so screenings that we use in substance use counseling. You also need to understand how to match the screening tool to the client's age and presenting concerns. And you also need to understand clinical reasoning and decision making. The skill related to this question is being able to select the most appropriate screening tool based on the client's age, presenting problem, and clinical setting. Question 4. A 29-year-old client entering substance use treatment reports a history of childhood abuse, multiple traumatic events, nightmares, and avoiding reminders of past experiences. The counselor wants to use a brief screening tool to determine whether the client may have trauma-related symptoms that require further assessment. Which screening tool is the best choice? A, PHQ-9, B, PCL-5, C, Cage Aid, D, GAD-7. Which screening tool is the best choice? All right, I see think I see D as an answer. I see a B. Okay, I see D. The correct answer is B, PCL5. The PCL5 is a PTSD checklist based on DSM-5 criteria. It's a screening tool used to identify symptoms of post traumatic stress disorder. PCL5 stands for Post Traumatic Checklist List 5 based on the DSM-5. This screening measures unwanted thoughts or nightmares, avoidance, negative changes in the client's mood, and arousal and reactivity. So, again, this is just a brief checklist. A is incorrect because the PHQ-9, which is the Patient Health Questionnaire, 9 questions, screens for depression. C is incorrect because the CAGE-8 screens for alcohol and drug use, not trauma exposure or PTSD. And D is incorrect because GAD-7 stands for Generalized Anxiety Disorder, 7 questions, screens for anxiety symptoms. While trauma survivors often experience anxiety, the client's history of traumatic events, nightmares, and avoidance makes this a specific trauma-related. These are trauma-related symptoms. So you will probably use the PCL5 before anxiety. So I see why a lot of you chose anxiety. So for a question like this, you need to understand both substance use and mental health screening instruments, just the main ones. The purpose of each screening tool. So the PCL5, you need to understand that that is a trauma-related screening. You need to understand how to match screening tools to the client's presenting symptoms. So this is a good one because a lot of you automatically thought anxiety, which people with PTSD can experience anxiety, but that's not the main presenting issue for this scenario. And you need to understand the difference between trauma, depression, anxiety during a substance use screening, or at least be able to distinguish between what is the main concern and match that to the tool you'll use. Question 5. A counselor is evaluating a client who reports drinking heavily for several years and stopped drinking 12 hours ago. The client is experiencing tremors, sweating, nausea, and increasing anxiety. The counselor administered the CYAR. Why is the CIWAAR the most appropriate tool in this situation? A, it identifies patterns of alcohol use and determines whether the client meets criteria for a substance use disorder. It measures the severity of alcohol withdrawal symptoms to guide clinical monitoring and treatment decisions. It evaluates the client's overall psychosocial functioning and identifies barriers to recovery. Or it determines the client's readiness to change and motivation for treatment. Why is this screening tool most appropriate for this situation? The correct answer is B, because it measures the severity of alcohol withdrawal symptoms to guide clinical monitoring and treatment decisions. The Clinical Institute Withdrawal Assessment for Alcohol Revised is a standardized assessment tool used to measure severity of alcohol withdrawal symptoms. It helps clinicians monitor withdrawal, identify clients at risk for severe complications. It stands, I already said what it stands for. And this would be considered a screening tool, even though assessment is in the name, because you're identifying risk of a specific symptom. A is incorrect because this describes the purpose of an alcohol screening tool, alcohol use disorder identification test, the audit. C is incorrect because this describes the ASI, the Addiction Severity Index. And D is incorrect because this describes the Socrates screening, stages of change, readiness, and treatment eagerness scale. A question like this, you will need to know the relevance of each specific screening tool. You need to understand the purpose of different screening tools. And the skill you need to know is the ability to appropriately screen or assess a client presenting with specific symptoms. So you need to be able to identify which screening tool matches the client's reported symptoms. Question 6. A counselor meets with a new client who was referred for substance use services. One moment. Before making clinical decisions, the counselor wants to determine whether the client may have a substance use disorder and whether additional evaluation is needed. When should screening occur in the counseling process? One moment, let me take a sip of my water. A, before establishing a diagnosis and developing an individualized treatment plan. B, before completing a comprehensive assessment and determining the need for the further evaluation. C, before selecting the appropriate level of care and recommending treatment services. Or D, before reviewing treatment progress and updating clinical goals. When should the screening occur in the addiction counseling process? Okay, I see C. I see a B. I see another C. I see, so it's between C and B. The correct answer is B, before completing a comprehensive assessment and determining the need for further evaluation. Screening occurs before a comprehensive assessment. Is a brief process used to identify potential concerns and determines whether additional assessment is needed. So A is wrong because diagnosis and treatment planning occur after a comprehensive assessment. So the screening does not come right before establishing a diagnosis. The screening is first. C is incorrect because determining the appropriate level of care occurs after assessment, not immediately after screening. And D is incorrect because treatment planning reviews occur during treatment. So you only review after you've started services and established what goals the client is going to be working on. So for this question, you need to know the timing of screening. Where does it happen during the addiction counseling process or the counseling process, just period? So you need to understand what happens in the counseling process from start to end and what order things go in. You also need to have knowledge of the difference between a screening, assessment, treatment planning, and treatment planning updates. The specific skill this speaks to: the ability to correctly sequence addiction counseling services. So you need to be able to understand what you're doing in each stage of the process and what should be happening in that stage. So you may get a question about treatment planning and they ask you something that you know is supposed to happen in screening. So understand screening, assessment, diagnosis, treatment planning, update of treatment plan, and then discharge. And understand what happens in each phase of the counseling process. Question 7. A counselor needs a tool to evaluate how substance use has affected multiple areas of a client's life, including medical, employment, legal, family, and psychiatric functioning to support treatment planning. This is an assessment question. Sorry, guys. Which assessment tool is the best choice? So we should say screening. So which screening tool is the best choice? If you want to get a little bit of information to gauge the client's risk. The correct answer is D. The ASI, the Addiction Severity Index. My apologies, y'all. This should have been under the assessment part. It's an assessment that evaluates how substance use affects multiple areas of a client's life. So ASI think assessment, different parts of their life. A is incorrect because the ACE questionnaire is for adverse childhood experiences. So this will lean to more towards trauma screening. B is incorrect because the SASI, which stands for Substance Abuse Subtle Screening Inventory, is a screening tool used to identify if the client has a substance use disorder. And it also gauges their if they're minimizing or denying substance use. And C is the CRAFT, and we know that's an adolescent screening tool. And it identifies alcohol and drug related risk. For a question like this, it still is relevant. You need to understand the difference between screening and assessment and what each screening tool does. You also need to understand how to appropriately select assessment or screening tools. And the related skill is the skill of appropriately screening and assessing clients and being able to demonstrate the ability to use the tools. Question 8. A client insists they only drink socially and denies having any substance-related problems despite multiple legal charges, family concerns, and a recent DUI. The counselor wants to use a screening tool that helps identify the probability of a substance use disorder, even when a client denies use. Which screening tool is the best choice? A, the Addiction Severity Index, the ASI. B, the ACE questionnaire, Adverse Childhood Experience questionnaire. C, the Substance Abuse Subtle. It's a tool to identify the risk or the probability. So some screening tools rely on self-report. The SASI includes subtle items that help identify individuals who may be reluctant to acknowledge that they have a problem. So it's a series of questions, and they ask questions in a few different ways, and then it calculates. There's a specific way you can calculate it, or they even have like not virtual. You can go online and do the virtual SASI, and it'll calculate the probability of the client having a substance use based on how they answered the different questions. A is incorrect because the ASI is a comprehensive assessment tool used to evaluate how substance use affects multiple areas of the client's life. The ACE questionnaire measures the traumatic experiences that clients have during their childhood. And the PHQ-9 is for, y'all put it in the chat. The PHQ-9 is for, let me see if y'all listening. Oh, sorry guys, can you guys hear me? Let's wait till we get back clear. I think I'm lagging a little bit due to either these ads or something that was changed and updated on. Let's see. Yes, Jasmine, depression. PHQ-9 screens for depression. All right. If you guys can still hear me, if I'm not lagging anymore, please put a 1 in the chat. If you're able to hear me clearly. I do see a message that says I might be lagging a little bit. Oh, it went away, so we're rock and rolling again. Okay. Thank you guys. Yes, PHQ-9 is for depression. And you'll probably use that screening a lot because you may see a lot of co-occurring issues. And it is a screening. Yes, one Nene Breed. I need to go in and change the settings so the ads can only come up after the live is over. So guys, my apologies. Please bear with me. I'm learning. We're growing. So a lot of these studio, I have to go in and manually change. So are you able to skip the are you guys able to, like, if an ad comes up, are you able to skip it? The screen will end shortly unless you restart your screening software. Okay, we may be having some technical issues, but I'll come right back up. Oh. All right. Are you guys able to hear me? Oh, are we in here? Oh, can you guys hear me? I'm going to see if I can go in and change it live. I don't want to disconnect though. Let's see. Open widget. Let's see. Are you guys able to hear me? Let's see. Error. Oh, you can? Can you hear me clear? Great. So it won't let me go in while we're live, but I'll make sure next time the settings have all of the ads off during live screen. My apologies. Okay, put a 1 in the chat if you can hear me clearly, guys, before I go on to the last 2 questions. My apologies. Thank you, Shaniqua Brown, 877. Okay. One Nana Bread. Letitia Banks, thank you. Okay. All right, question 9. A client seeking treatment for opioid use reports feeling hopeless, having difficulty sleeping, and experiencing frequent panic attacks. The counselor suspects the client may have a co occurring mental health disorder in addition to a substance use disorder. How can screening best assist the counselor in this situation? By confirming a mental health diagnosis and determining the appropriate level of care. B, by identifying potential co occurring concerns and determining whether further assessment is needed. C, by developing measurable treatment goals for both substance use and mental health disorders. Or D, by evaluating the client's response to treatment and determining readiness for discharge. How can screening best assist the counselor in this situation? Okay, I see a B. Oh, I found the button, y'all. I could delay the ads. Oh, it only let me do it for every 10 minutes. Okay, so for every 10 minutes, I can click delay ads. Okay, check me out. Am I screaming? Am I streaming? All right. So you shouldn't have any ads popping up for the next 10 minutes, and then I can just hit it again. All right. All right, guys. Okay. Which one describes how screening can best assist the counselor? Okay. I see A. I see a A. Let's see what other answers you guys come up with. Okay, I see a B. Okay, I see another B. Let's see what we got here. The correct answer is B, by identifying potential co occurring concerns and determining whether further assessment is needed. B is correct because screening helps counselor identify signs and symptoms of possible co occurring disorders, and it determines whether a more comprehensive assessment is needed after. In screening, we do not diagnose in screening. It's just the way we identify if the client needs an assessment. So it just, alerts us and gives us more insight as to what the next steps are going to be. A is incorrect because a diagnosis requires a comprehensive assessment, not a screening. C is incorrect because treatment goals are developed during treatment planning after the assessment and after if the client needs to be diagnosed. And D is incorrect because evaluating treatment progress occurs after treatment has already begun. So, what you need to know, you need to understand the purpose of screening for both mental health substance use conditions and mental health conditions if there's a co-occurring issue. You need to understand the difference between screening and diagnosing and when you can diagnose. You need to understand how to recognize if there are co-occurring issues. And this comes up a lot in real everyday practice. And you also need to understand what co-occurring issues look like. And then you need to understand the clinical sequence of addiction counseling. The related skill, you need to understand, you need to be able to recognize signs and symptoms of co-occurring disorders. And that's when a client has both a mental health condition and a substance use condition or diagnosis. And the most important thing you need to remember about co-occurring disorders is they need to be treated at the same time. Even if you can't do the mental health component, you need to refer out. We'll be doing co-occurring disorders next week. Question 10. During an initial screening, a client reports physical abuse, parental substance use, and exposure to domestic violence during childhood. The counselor wants to better understand how these experiences may affect the client's behavioral health. Why would the counselor use the ACE questionnaire during a screening? A, to identify childhood experiences that may increase future behavioral health risk. B, to identify trauma symptoms that may indicate a stress-related disorder. C, to identify life areas affected by substance use and addiction severity. Or D, to identify substance use patterns that may indicate a substance use disorder. Why would the counselor administer the ACE questionnaire or ask the ACE questionnaire? Okay. The correct answer is A, to identify childhood experiences that may increase future behavior health risks. A is correct because the ACE questionnaire is a screening tool used to identify potentially traumatic experiences that occurred before age 18. So, research shows that higher ACE scores are associated with an increased risk of substance use disorders, mental health conditions, chronic medical illnesses, and other adverse outcomes. B is incorrect because this describes the purpose of the PTSD checklist. C is incorrect because this describes the ASI. And D is incorrect because this describes the SASE. The knowledge that you need to know for a question like this, the purpose of the ACE questionnaire. Again, this might be one of the ones you need to get familiar with. Because if you see a lot of clients that have prevalence of high traumatic experiences, you be familiar with screening for trauma symptoms and the impact of trauma. They may not even have PTSD, but they may be impacted by traumatic experiences. You need to understand screening tools and how to distinguish between all of them. So it mentioned the PTSD screening, which you may need to use both. So you need to understand what the ACE questionnaire is, but also other PTSD or trauma related screenings because you may use both. You can use several different screeners together depending on what the client reports and depending on if the screening is appropriate. But for this scenario, it would be the ACE because they're only speaking to childhood trauma. All right, and the related skill, You need to understand the skill of appropriately screening for reported symptoms. All right, so we have a few minutes before we go on to, oh, let's do the key takeaways. Let me make sure y'all still can hear me. Oh, that hour went by fast, y'all. Time just be going on. Let me take a swig of my water and then we're going to go over key takeaways. All right, key takeaways. Okay, so the first thing that you need to remember about just generally screenings in the addiction counseling process is that it's used to identify risk. It's brief. You can use one or more screening tools, but it's not a long assessment process. These are evidence-based screening tools that have been proven to help you identify if there's further issues or if you need to go in the next step of the addiction counseling process. A positive screening tells you that something may be going on, but an additional assessment is needed before making any other clinical judgments. Second, the screening is the first step in the clinical process. Before you assess, diagnose, or develop a treatment plan, there needs to be some type of screening. Another key takeaway, selecting the right tool. Screening tools are based on the client's presenting concerns. So you need to be able, as an addiction professional, they're testing you on whether you can get the information that was gathered, client's age, symptoms, history of trauma, substance use concerns, or any other clinical questions that they ask before getting to the screening. You need to be able to match the appropriate screening so you can figure out if there's a deeper issue or if the client is at high risk. Another key takeaway, you need to understand the main or the most popular evidence-based screening tools for both substance use and then maybe 3 or 4 for mental health. Definitely PHQ, definitely GAD-7, because as addiction professionals, you'll often hear clients say, I had anxiety when I stopped using. I get bad anxiety when I use. So as the professional, you need to start to figure out, is the substance causing the mental health symptoms or the other, or are they co-occurring? All right, and lastly, another key takeaway is that screening guides the next steps in the clinical process. And remember, screening can also rule out the need for substance use treatment. Don't forget that part. So you may get clients that are referred by parents, school, work, and the sole purpose of you seeing them is to screen them. And you may find, oh, according to this my screening, you're not at high risk. you may not need to, you don't need to move forward with full treatment. Maybe we can do some psychoeducation or brief intervention, briefs, you know. So don't forget that part either. Sometimes you do a screening and the client does not need treatment. All right, let's do like maybe 1 minute. Any questions? Any updates before we go on to hour 2? I'll give it 2 minutes in case you want to scratch or stretch. Oh. All right. Let's see. My chat. I don't see. Went by fast, guys. All right. All right. All right, guys, we are gonna get on started for hour 2. Let me let the chat catch up. Hi, Shanique Brown. She says, I'm in here. I take my test at the end of the month. All right. Let's get it done. Let's pass. I'm trying to make sure the chat, trying to make sure you guys didn't have any brief questions. The chat is moving kind of slow for me. All right, Jasmine Hernandez says, I'm taking mine on Sunday. Best wishes. You got it. All right, let's get hour 2 rolling. All right. If you're just joining us, welcome to our 3-hour study intensive. We're on hour 2. Hour 1, we cover screening. Hour 2, we're going to talk about assessments. which is the second step in the addiction counseling process. So it was only right we start off our first 3-hour intensive with the first 3 parts of the counseling process. So come on in if you're just joining us. If you're still with us, hang on in there with me. I want to see who's going to do the whole 3 hours. So what to know about assessments for your addiction counselor exam? So you need to understand what the comprehensive assessment process is. So unlike screening, which is a brief process identifying potential concerns, the employment, strengths, supports, and cultural factors. So you're assessing the whole person in order to support them with the substance use issue. An assessment helps you gather information so you can identify patterns and recognize risk factors so you can determine your client's needs. The assessment also helps you make an informed decision about the client's treatment and care. The information you collect helps you decide on the next clinical steps. So you're trying to understand, does the client need additional assessments? Do I need to make a referral? Is the client having medical issues? So your exam is testing your ability to make a safe and ethical decision about client care from the information that they provide you. That's very important. So that's why you need to read the questions carefully and only base it off what the exam is asking you, not what could happen, not what happens like at your agency, only the scenario they present in front of you based on what you know. And lastly, remember the assessment drives the treatment planning. So treatment does not start without an assessment. Okay, let me check the chat before we get on with our questions. All right, so before we start the questions for hour 2, can you please put a 1 in the chat if you can hear me clearly, if I'm not lagging, you don't have an issue with, oh, let me pause the ads again, y'all. Okay, so we shouldn't have an issue with the sound breaking up. I believe it's these ads that they have on in. Okay, thank you, Jasmine. Okay, Shanique. So are you talking about the full presentation, or you're talking about those pictures that I have at the beginning of each hour? Those you can get off the community posts under the community post tab on YouTube, and I also emailed them for those who are on the email list. Thank you, guys. Thank you, extra good one. Thank you. And yes, Jasmine, you guys can also screenshot. So if you're a person that's would rather screenshot, you can screenshot it, or you can save it to your computer if you're on my email list. So I always send the graphics with the email reminders if you're on my email list, and then I also post the same graphic under the community post. All right, thank you, Sherry. All right, glad you guys can hear me clear. I think it was the ads. Okay, the skills you need to know for assessments. Information gathering. So this falls under two skills, actually, information gathering and counseling skills. Because in order to be able to gather information accurately, you got to have very good rapport building skills. So a quality assessment starts with collecting accurate, relevant information from the client and other appropriate sources. The more complete your information is, the better your clinical decisions will be. You also need to be able to assess the client's needs. So when you're gathering information, you need to be able to identify the client's needs in the moment, what they're reporting. So are there any safety concerns? Are there any medical concerns? Are there any withdrawal symptoms? Do they need immediate support? Do they need something before treatment can begin? So these, you're just doing ongoing assessing as you're building rapport with the client and gathering that information for the assessment. You also need to be able to identify the client's strengths. So the assessment is just not about quote unquote what's wrong with the client or what has negatively impacted them. You need to be able to identify their strengths so you can incorporate that into the treatment plan. You need to figure out what's working for them, because that's going to be important too. On the exam, you need to recognize protective factors like family support, motivation for change. What coping skills do they have? Employment, and any community resources they have access to. And again, the strengths will always be incorporated into the treatment plan. And also, there's no such thing as a client that don't have any strengths. If they are showing up, that is a strength. And you also need to be able to make recommendations based on your assessment. What should happen next? So you need to be able to gather the information and then analyze the information you gathered and then make the appropriate recommendations and support them with the next steps. So that is what the exam, so assessment type questions are seeing if you have that skill. All right, question 1. Which statement best describes the primary purpose of a comprehensive assessment? A, to understand the client's needs and guide clinical decisions. B, to determine the client's eligibility for treatment services. C, to identify available resources and support systems. Or D, to confirm information gathered during screening. Which statement best describes the primary purpose of a comprehensive assessment? Okay. Okay, I see lots of A's. The correct answer is A, to understand the client's needs and guide clinical decisions. A comprehensive assessment is conducted to evaluate the client's needs and guide treatment recommendations. As the addiction professional, you gather detailed information about the client's substance use, mental health history, medical history, and so on. So you are supporting the client with answering the question, what do they need? A is incorrect. Oh, sorry. B is incorrect because determining the eligibility or placement may result from an assessment, but is not the main purpose. C is incorrect because identifying strengths and supports and referrals are indeed an important part, but it's only one part of the assessment and not the primary purpose. And D is incorrect because the assessment builds on information gathered during the screening and the assessment. and may include collateral information to clarify findings. However, its purpose is not simply to confirm previous information. It is to develop a complete understanding of the client. So you take what you learned in the screening, move forward with the comprehensive assessment. Question 2. Which statement best describes information gathering during a comprehensive assessment? A. It focuses primarily on the client's presenting problem and current symptoms. B. It emphasizes information obtained through standardized assessment screenings. C. It collects information from multiple sources to understand the client's overall needs. Or D. It relies on client self-report to establish treatment recommendations. Which best describes information gathering? Okay, I see a C. I see another C. Okay. Actually, I see all C's. The correct answer is C. Information gathering is the foundation of a comprehensive assessment. Addiction counselors collect information from multiple sources, including the client's collateral contacts, intake information and documents, records, observations, screening results, and so on. A is incorrect because the presenting problem is an important starting point, but a comprehensive assessment evaluates the whole person. B is incorrect because assessment instruments provide valuable information, but they are only one source. So you're going to use clinical interviews, observations, again, collateral information. If you've done a records request, you can see previous treatment. And D is incorrect because client self-report is valuable, but should be considered alongside with other assessment findings. Treatment recommendations should be based on multiple sources of information. Question 3. Which approach best demonstrates how a counselor should present assessment findings to a client? A. Emphasize the client's areas of need when discussing the assessment results. B. Review the assessment findings and recommend the appropriate treatment. C. Explain the assessment results using clinical terminology and diagnostic language. Or D. Present the assessment findings objectively and with empathy. So which one best demonstrates how you should explain or present assessment findings to your client? Okay. I see a D. I see another D. The correct answer is D. Your assessment findings should be presented objectively and with empathy. Addiction counselors should communicate results in a clear, respectful, non-judgment manner while acknowledging the client's experiences and emotions. So this way you can strengthen rapport and promote client engagement. A is incorrect because although areas of need should be discussed, counselors should also recognize the client's strengths, their protective factors, and current available supports. So you're not just focusing on areas of need or substance use issues or what they're not doing right. You want to balance explaining the results with um, strengths, available resources, and then you also discuss the deficits or the areas of need. B is incorrect because reviewing findings and discussing treatment recommendations are appropriate after the assessment is completed. However, the question asks how the findings should be presented. The best approach emphasizes objectivity and empathetic communication. So not moving straight to the next steps. So making sure your client understands what this means. Present it in a developmentally appropriate way, especially if you work with children and adolescents, making sure they understand their own needs and what's next in the clinical process. And C is incorrect because counselors should avoid unnecessary clinical jargon and explain findings in language the client can easily understand. And that will also fall under client-centered or person-centered care. So you need to be able to have the skill of explaining these results to your client. So the knowledge is being tested in a question like this. You need to know how to present your assessment findings. What does that look like for addiction professionals? You need to understand empathetic and therapeutic communication. You need to understand person-centered care. And you also need to understand the counseling skill of client engagement and rapport building. The specific skill related to this question is presenting assessment findings. The most important thing to remember is you present the findings empathetically on their developmental or learning level. Be objective, and you're collaborating with them. Question 4. Which statement best describes when assessment occurs during the addiction counseling process? A. Assessment is completed before treatment begins and upon request after. B. Assessment is conducted after screening and remains unchanged throughout the treatment. C. Assessment begins early in services and continues as new clinical information emerges. Or D. The assessment is completed after treatment to determine whether services are effective. Which statement best describes when the assessment occurs in the addiction counseling process? Okay, I see some C's. The correct answer is C. The assessment begins early in services and continues throughout service. As the treatment progresses, counselors gather new information, monitor changes, and you reassess. Reassessment is ongoing. And you make updates to the treatment plan, updates to your recommendations as you go along, as the client's needs changes. A is incorrect because an initial assessment occurs before or at the beginning of treatment. Addiction counselors continue to assess throughout the treatment process. So you're monitoring their circumstances, any life changes, even their strengths, symptoms, and anything that needs to change. B is incorrect because the assessment follows the screening, but it should be updated whenever new information becomes available. Effective addiction treatment requires ongoing reassessment, no matter how large or small the change, because a small change can impact treatment significantly. And D is incorrect because evaluating treatment outcomes is part of the progress monitoring and discharge planning, not the purpose and timing of assessment. So, what you need to know about a question like this is the knowledge that you're being tested on is the timing of assessments. Do you know when the assessment occurs in the counseling process, and do you know that you're completing ongoing assessment throughout treatment? This is also testing your knowledge of continuum of care. So, do you understand how ongoing care of our clients happens in the process? And the specific skill is your ability to conduct ongoing assessments or assessing throughout treatment planning. So, what does that look like? Question 5. What best describes the primary purpose of a biopsychosocial assessment in addiction counseling? A, to identify factors that influence the client's motivation, recovery supports, and treatment engagement. B, to develop a comprehensive understanding of the client's overall functioning. C, to determine the client's service needs, level of care, and treatment referrals. Or D, to identify the client's strengths, risk factors, and barriers to recovery. Which answer best describes the primary purpose of a biopsychosocial assessment? Okay. What do you guys think? I see a C. I see an A. All right. The correct answer is B, to develop a comprehensive understanding of the client's overall functioning. A biopsychosocial assessment is a comprehensive evaluation designed to develop a complete understanding of the client's overall functioning. It examines biological, psychological, and social factors that influence the client's health, substance use, strength, risks, and treatment needs. A is incorrect because motivation supports and treatment engagement are important areas to assess, but they represent only one part of a comprehensive assessment. C is incorrect because your assessment findings help determine service needs, level of care, and referrals, but these are clinical decisions that result from assessment, not the primary purpose. And D is incorrect because identifying the client's strengths, risks, and barriers is an important component of a biopsychosocial assessment, but it does not represent the full scope of an assessment. So the knowledge that's being tested on a question like this, the purpose of comprehensive assessments. And a biopsychosocial is just a type of comprehensive assessment. So you might see assessment, a comprehensive assessment they're pretty much talking about a biopsychosocial. If you have an assessment that's asking about medical and mental health history and social functioning, family history, it falls under biopsychosocial. They're also testing if you understand the purpose of a comprehensive assessment, especially as addiction professionals. We don't only assess for the substance use issue. Again, we're assessing the entire person. And it's also testing your knowledge of your clinical decision-making skills. The related skill for this question is your ability to conduct a comprehensive assessment by gathering appropriate information and integrating that information to understanding the client's overall functioning. So they're testing your ability to gather the appropriate information, which is everything that falls under the comprehensive assessment. Question 6. Which statement best describes an integrated model of assessment in addiction counseling? A. It evaluates substance use separately from mental health and medical concerns. B. It emphasizes standardized assessment tools over clinical interviews and observations. C. It prioritizes the client's primary diagnosis before evaluating other areas of functioning. Or D. It evaluates multiple factors simultaneously to develop a comprehensive understanding of the client. Which one best describes an integrated model of assessment in addiction counseling? Okay. The correct answer is D. It evaluates multiple factors simultaneously to develop a comprehensive understanding of the client. The integrated model of assessment evaluates the client as a whole person, considering all parts of the person in their life: substance use, mental health, medical conditions, family, social, legal issues, and their strengths. This approach is especially important when working with clients who have co-occurring disorders. A is incorrect because integrated assessment does the opposite. It recognizes that substance use, mental health, and physical health often influence one another. B is incorrect because integrated assessment uses multiple sources of information, including your clinical interview, your observation, medical records, previous treatment records, collateral information. Sometimes they'll bring in family or a trusted friend to help them express or report their experiences with substance use. So you're using multiple sources. And C is incorrect because an integrated assessment examines all relevant areas before making clinical decisions. It does not just focus on one diagnosis while overlooking other factors that may influence treatment. So the knowledge is being tested on a question like this: your knowledge of integrated models of assessment, your ability to assess the whole person. So you're gathering information from different parts of the client's life, your knowledge of co-occurring disorders, and your ability to administer a comprehensive clinical assessment or evaluation. So that's what they're testing your ability with questions about integrated models, or what will you do in an assessment, what type of questions you need to ask during an assessment, what is a comprehensive assessment. Those types of questions are just testing your knowledge to be able to conduct it. The related skill on a question like this, your ability to apply integrated assessment approaches. So your ability to effectively gather information, but from several sources and from several parts of the client's life. All right, so before I read question 7, please put a 1 in the chat if you can hear me clearly, if I'm not lagging, you're not having any issues with my audio. Thank you, Cicely. Thank you, One Nene Bread. Thank you, Letitia. I appreciate y'all. Okay, let's go on to question 7. Question 7. Which information is most important to obtain during a substance use assessment to determine the severity of a client's substance use disorder? A, the client's age of first use, family history, and previous treatment experiences. B, the client's pattern of cravings, motivation for change, and recovery supports. C, the client's pattern, frequency, quantity, and consequences of substance use. Or D, the client's medical history, co-occurring symptoms, and current medications. So all of this information is important, but which one of these is the most important to obtain during a substance use assessment to determine the severity of the client's substance use disorder? Okay, I see lots of C's. The correct answer is C, the client's pattern, frequency, quantity, and consequences of substance use. And consequences can be impact on functioning, impact on daily living, things like that. The pattern, frequency, quantity, duration, and consequences of substance use provides the strongest information for determining the severity of a substance use disorder. These findings help addiction counselors evaluate the extent of the substance use, help them also identify functional impairment so they can make informed treatment recommendations. So it has to be this combination. So, for example, you can't make a full appropriate clinical decision if someone just says, they come in, they say, I smoke marijuana, or I do a specific substance. So you have to use your information gathering skills to ask the questions to start here to get the pattern, the frequency, the quantity, so you can make a clinical decision. So it can't be vague information. A is incorrect because these factors provide important background information and may indicate risk for developing a substance use disorder, but they do not directly determine the client's severity. And remember, severity is directly related to level of care. So if you can't get a clear severity, how can you get an appropriate or accurate level of care recommendation? B is incorrect because cravings and motivation help guide treatment planning, and recovery supports identify protective factors. However, they do not provide the most comprehensive picture of the severity of the substance use disorder. And D is incorrect because medical and mental health information is important for a comprehensive assessment, especially when co-occurring disorders are present. However, these factors alone by themselves do not determine the severity of the client's substance use disorder. So a question like this is testing your knowledge of a comprehensive substance use assessment, how you determine not only the diagnosis, but the severity of the diagnosis. It's also testing your clinical decision-making skill. And the related skill is your ability to gather the appropriate information and analyze the substance use history to determine the severity of the substance use disorder. So you need to understand how we diagnose, how we identify the severity, and how do we use that information that we get from the assessment. And of course, you guys already know we use it to identify level of care and support the client with treatment planning. All right, question 8. A counselor has completed a comprehensive assessment and identified a history of daily opioid use, symptoms of depression, unstable housing, and limited family support. What is the most appropriate next step when interpreting the assessment results? A, prioritize the client's most significant clinical needs when developing recommendations. B, focus on the client's primary substance use concern before addressing other findings. C, review each assessment finding independently before determining treatment goals. Or D, base treatment recommendations on the client's presenting problem and self-report. Okay, what is the most appropriate next step when interpreting or understanding the assessment results? Okay, I see C, I see A, I see B. Okay, let's look at the question. Let's do a question breakdown. I'll be doing a pre-recorded video on difficult questions or questions who have strong distractors. Distractors are the answers on tests that are so close you think they're the same. So I'm going to do a video on that in September. So let's go through this question. So the counselor has completed the assessment, identified some information, symptoms, limited, and some social factors too. What is the most appropriate next step? So the most, do I focus on the most significant needs, like maybe the things that stand out the most or have the potential to have the most harm? Do I do just substance use because I'm the substance use therapist? Or do I review the assessment by itself before determining the goals? Or do I look at treatment recommendations off what the clients say their problem is? Okay, let's see. The correct answer is A. Interpreting assessment results requires addiction counselors to integrate all assessment findings, identify the client's most significant clinical needs, and prioritize recommendations that support safe, effective, individualized treatment. Assessment findings should guide clinical decision making, not just describe the client's problems. Also, A is correct because what the client may perceive is their main problem may not be the whole story. Because remember, they typically don't have the clinical background we have. So they may present with a substance use issue and they have very clear needs, but they may be just focused on one specific need. But you, as the professional, can support them with identifying what, the other needs are. So you're working together. So, yes, our clients are the expert on their life, but remember, they often come to us. Um, in pain or, emotional pain, physical pain, maybe going through withdrawal symptoms, maybe, just several different layer issues. So you can't just go off just one aspect of the assessment and you just can't go off self-report. I hope I explained that clearly. B is incorrect because although substance use is important, addiction counselors should consider all assessment findings, including mental health, medical, housing, family, and safety concerns. So again, you consider previous treatment, previous records. C is incorrect because assessment findings should be integrated, not interpreted in isolation. Clinical decisions are based on how different factors interact and influence the client's functioning. And D is incorrect because treatment recommendations should be based on all available assessment data. So a supervisee asked me, because remember, sometimes we think more like, because we're seasoned clinicians, many, if not all of us, already work in the field. So a supervisee said, "Hey, Miss Wiggins, most of the time when we do assessment, we don't have the medical records back in time." And I said, "Well, first of all, remember, we're in a perfect world on the exam. On the exam, the world is perfect. We have everything we need. We have copies of, we've already signed our release forms. We have the client's previous medical records. We have the client's collateral contacts." But to answer the question, if you are working with a client and you don't have all of their previous medical records and all of that, you still have other sources of information like intake forms, your intake questionnaires, and then guess what? You complete the comprehensive assessment. If you support them with developing a treatment plan, and guess what? We do ongoing assessing. So if 2 to 3 weeks into treatment, you get their medical records and it's more severe than you thought, or you have questions about something that the client didn't report, then you adjust it. You work with the client as needed. So even if you work in a setting where you only have the client's intake information and self-report and maybe one other collateral contact, it's okay. But on our exam, it is a perfect world. Don't overthink it. Don't overthink it, because us clinicians will overthink it, especially those of us who've worked years and years in the field. We know there's so many different factors that can impact treatment. But for your exam, you're in a perfect world. You have everything you need. You're just being tested on your ability as a clinician. All right. Question 9. Assessment results are used for all of the following purposes except A, prioritizing treatment needs and developing clinical recommendations. B, identifying the most appropriate level of care and support services. C, predicting whether the client will successfully complete treatment. Or D, identifying client strengths, barriers, and referral needs. So this is an accept questions. So the question is saying everything is right except which one? Okay. So these type of questions sometimes trip us up if we are overly nervous, we're anxious, and we're reading the questions really fast and we don't pay attention to what it's really asking. So if you get in which one is wrong question or which one accept question, be careful with those type of questions. So if you get some accept, they're just asking you which one is wrong. Okay, I see a lot of C's, y'all. I see a lot of C's. The correct answer is C. Assessment results help counselors understand the client's current functioning and make informed clinical decisions, but they cannot predict whether a client will successfully complete treatment. Treatment outcomes depend on many factors, including motivation, engagement, environmental supports, living circumstances, and so on. A is incorrect because assessment findings are used to identify the client's most significant needs and develop individualized treatment plans. So A is correct. A is true. B is incorrect because assessment findings help determine the appropriate intensity of treatment and identify additional services that may benefit the client. And D is incorrect because a comprehensive assessment does identify both risk factors and protective factors, allowing addiction counselors to make appropriate referrals and recommendations. This question is testing your knowledge of appropriate uses of assessment results. They're also testing your clinical decision-making skills. They're testing your knowledge of treatment planning. And they're also testing if you know testing to see if you know the purpose of level of care decisions. The related skill for a question like this, your ability to interpret assessment findings and to prioritize client needs. So they want to see if you understand what to do with assessment results, what's the purpose, and what the assessment results, what information is going to give you. Question 10. A counselor is developing a comprehensive written summary based on the results of the client screening and biopsychosocial assessment. Which documentation practice is least appropriate? A. Include findings that support treatment recommendations and clinical decisions. B. Include objective observations using current clinical terminology. C. Include relevant strengths, needs, and factors affecting client functioning. Or D. Include subjective conclusions based on the counselor's clinical expertise. Which documentation practice is least appropriate? Now, they all sound good, right? But one is least appropriate. One is wrong. Well, not wrong. Yeah, wrong. One is wrong. One is something you should not do. Okay, let's see what you guys say in the chat. Okay, I see some D's. See, okay, I see D. All D's actually. You guys are correct. D is the least appropriate. What word stands out for you guys? Put it in the chat. What word from answer D sticks out like a sore thumb that immediately told you, oh no, this is wrong. This is the least appropriate. Okay. Hopefully, it was subjective. Documentation should be objective, meaning not your own opinion and judgments, but objective, accurate, supported by assessment findings. So, your clinical perspective, not your overall opinion. So, you should be aware of our standard documentation practices in the counseling profession. Although addiction counselors use their clinical expertise to interpret assessment results, documentation should not consist of subjective conclusions that are unsupported by objective evidence. Clinical impressions and recommendations should always be based on the information gathered during the screening and during the assessment. A is incorrect because this reflects best practices. Assessment summary should clearly document the findings that support treatment recommendations. B is incorrect because objective observations are best practices. So you should be objective. Facts and clinical perspectives and clinical findings based on what is documented and reported. This helps ensure continued care and effective communication among providers. C is incorrect because a comprehensive assessment should document both the client's strengths and areas of need, and it is best practices. This question is testing your knowledge of best practices in clinical documentation, your ability to understand objective versus subjective. So you might get a question like, they might give you actual quotes, and you need to be able to pick the best documentation quote. So if you have knowledge of what's objective documentation and what's subjective documentation, you will have no problem answering any documentation questions, because you will immediately know if someone's inserting their own opinions or being subjective versus being objective. They're also testing your knowledge on comprehensive assessment summaries, and how you report the information that you've gathered from the comprehensive assessment. Okay, and the related skill is, as an addiction professional, you need to have the skill of being able to develop a comprehensive written assessment summary. You need to be a document what you're doing in an objective way, so that you're able to communicate the client's strengths, needs, and overall functioning. All right, your key takeaways for hour 2 on assessments for addiction counselor exams. You need to remember that an assessment is ongoing. It's not a one-time event. You do not do an assessment only in the beginning and just use those findings for the rest of treatment. It has to be ongoing. It starts early in the counseling process, but you continuously gather new information and you continuously assess. You also need to understand that we are assessing the whole person, although we are addiction professionals, but assessment looks at the entire person. We consider their strengths, their physical health, mental health, and any family relationships. Another important point that you need to take away is that we put all the pieces together. We conceptualize the information that's given to us. Don't rely on one screening or one assessment or just the clinical interview. You take information from several sources and you use your clinical expertise to not only explain it to the client, but to make sense of what the treatment is going to be. When it comes to documentation, you need to keep it objective and evidence-based. Your assessment summary should reflect what you observed, what the client reported, and what the assessment results supports. So no assumptions, no personal opinions. And lastly, remember that the assessment drives everything that comes next in the treatment process. The information you gather determines the diagnosis, the treatment recommendations, referrals, level of care, and ultimately the direction of the client's treatment. So even if you don't go on to work with the client, your assessment may be the foundation, because let's say they have to up and move, or their insurance doesn't cover anything, which they probably won't say anything about that on this exam, but just for real life purposes right now. Your assessment should be solid so the next clinician or the next care team partner can have a solid roadmap. They can just go straight to your assessment, your recommendations, and use that as a part of their now ongoing assessment process. So that's what I always think about when I'm doing assessments. Like, I want to get it, as accurate, as solid. That way, everybody working with the client can get a clear idea of how to best support them. All right. We've made it to hour 3. No worries, Joanne. And I am working on, I had a little bit more time this week. I'm moving into more difficult questions, leaning to more towards clinical decision making. So some of the questions may be a little, difficult. It's all good. I don't know if you guys were in here before, but I'm working on a pre-recorded video for September. Questions, more difficult questions, where all of the answers seem like they could be right, or 2 of the answers are really close. So those type of videos take me longer, because I go through it and see how I can trick y'all up. No, not trick y'all up, but you know what I mean. So I need to have very good distractors. And believe it or not, you can use AI for the starting point, but AI and chat does not do it all, guys. They are wrong. First of all, they be wrong. So you got to go through every question. And to get the very difficult questions, I will rework a question 5, 6, 7, 8 times. So if you're a study person, I have supervisees who do get study questions from chat AI or chat GPT, which is fine, but make sure you read through your questions, because they'll either be very general, which is fine for foundational practice, but when I want to make the question a little bit more challenging, or to support you guys in your clinical decision making, we know more. We know more than chat. We're the professionals. So if you got them wrong, it's because I'm practicing making the clinical decision making questions a little bit harder, especially for our study partners who are studying for the AADC, the NCAC2, or the MAC. Those tests are a little bit more difficult because they go into more clinical decision making. Oh, who's been here since hour 1? It's going by fast. Okay, I'm going to do a quick stretch. I'm going to just stand up a few, and then let's rock and roll. Let's go to the next. Our last hour. All right. Not too bad, huh, you guys? Not too bad. I got this idea. First of all, for those of you who can't make it weekly, and maybe you reserve just the 3 hours so you can just get one long 3-hour in. And also, when I was in school, I loved my classes that were really long, because I just got it out the way for the week. And I was like, okay, let me make some time for an intensive session so we can see if we can do 3 hours. Shanique Brown says, AI got me taking the test over at the end of the month. No worries. You got it this time. But yeah, I say with you know, use it as a guide. Don't depend on it. And I know everyone says, "Oh, AI is taking over." I don't think AI not taking over our profession, you guys. It's nothing like human interaction. It's nothing like human interaction and human thought. And believe it or not, AI gets it wrong. AI is not working in the field every day. AI is just a fast way to gather a lot of information, which is okay. It's a tool, but they get questions wrong. They get information wrong. They generalize things. So just with everything else, just use it as a tool, but double check and triple check. Hi Cicely, did you are you on the email list or did you check the community post? We're starting at 6 for the month of August because we're doing these intensive 3-hour sessions. But it's all good. I'm glad you're here. I made a couple reminder posts. I sent an email and I also put it on the community post section. So next week, if you want to do the 3 hours with us, log on at 6. No worries. It's all good. I'm glad you're here now. All right. Hour 3, guys, is all about treatment planning. So hour 1, we reviewed screening, the first step in the addiction counseling process. Brief questionnaires. We're trying to identify risk. Nothing too detailed or in depth. We're just trying to figure out what the next steps are going to be. Hour 2, we focus on assessment. You need to understand what it is, how to conduct the assessment, information gathering, rapport building. You need to understand how to analyze that information, how to share that information with your client. And now we're here at treatment planning for hour 3. So you've completed your assessment. You've explained the results to your client. You're collaborating with your client. You're preparing to collaborate with your client so they can develop some treatment goals. So now we're here at treatment planning. And again, you guys, I post these graphics on the community post. And it's just like a quick, simple guide. Just a quick peek. And I also send it in the email if you want to download it to your computer, if you want to download the actual picture or the graphic. All right, what you need to know about treatment planning for your addiction counselor exam. Your tests or your exams emphasizes that treatment planning is a collaborative process. You don't develop the goals for the client. The client doesn't come in with their own goals. You guys are working in tandem together. The addiction counselor and client develop the plan together, and it's not something you do for the client. It's something you do with the client. You also need to know how to write SMART goals or SMART objectives. So the goal and then the objectives are SMART. That means your treatment planning goals that you develop with your client, they will always be specific, measurable, achievable, relevant, and time bound. So there needs to be an end date The exam will also test you on the difference between a broad goal and a measurable objective goal. So you may get a question testing your ability to understand that a goal is not a SMART goal, because you need to be able to, as treatment goes on, you need to be able to track if the client is progressing or regressing. If your goal is too general, how are you measuring? You also need to know that treatment plans should include evidence-based interventions. Number one, exams love CBT. Now, I'm not saying that CBT works on everybody. I'm not saying CBT, because there is research that shows CBT sometimes cannot be used on clients with significant traumatic experiences. Remember, in exam world, everything is perfect, and we're using the evidence-based practices that are often seen in addiction counseling treatment that research has backed. And finally, remember that the treatment plan is a live document. It's never ending until the client is in finished discharge, signed by both you and the client for whatever reason for discharge, whether it's they reached their goals, they have decided to end treatment, or they need to go to a higher or lower level of care. The document can be adjusted and changed as needed. And also, you should review it regularly and update it whenever the client needs progress, strengths, or circumstances change. All right. The skills. So, the skills that you are being tested on and that you need as an addiction professional, you need to be able to interpret assessments. You need to be able to understand, if you read the client's assessment, whether you did it or another practitioner does it. You need to be able to understand what the assessment means so you can support the client in developing the goals with them. Everything starts with your ability to understand. So you're not just collecting information, and sometimes you may not even be the one collecting the information. You need to be able to interpret the assessment, period. Maybe another clinician did it. The assessment should tell you what the client's needs are. From there, you need to be able to conceptualize the findings, meaning you need to be able to connect the dots. So you'll ask questions like, how do these assessment results explain the client's current challenges? What should be addressed first? What are the most pressing needs from my clinical standpoint? And how do the client understand their needs? So the exam is testing your ability to clinically reason. So they'll ask you questions about next steps, and the assessment yielded, or the assessment says the client has this disorder with this severity. You need to be able to make sense of that so you can help decide what the treatment plan is going to look like. And lastly, you need to be able to develop SMART goals. All right. Let me make sure we're good. All right, guys, please put a 1 in the chat if you can hear me clearly. Just want to make sure we're good before we knock out these last 10 questions. Yes, Angel sent first, 6 p.m. Eastern, every Wednesday, just for August. All right, guys, let's rock and roll. Question 1. Which action is most essential during the treatment planning process? A. Prioritize identified needs based on the assessment findings. B. Select interventions that match the client's treatment goals. C. Develop measurable objectives that support identified goals. Or D. Collaborate with the client to develop an individualized treatment plan. Which is most important during the treatment planning process? The correct answer is C. Oh, my apologies. The correct answer is D. Treatment planning is a collaborative process. So that should have stood out to you, the word collaborate. The client should actively participate in developing goals, identifying their priorities, and selecting interventions. Collaboration promotes engagement, increases motivation, and supports person centered care. A is incorrect because prioritizing needs is an important part of treatment planning, but it should occur with the clients. Assessment findings guide the priorities, but collaboration is the foundation of effective treatment planning. B is incorrect because interventions should align with treatment goals, but they are developed after goals and objectives have been established together with the client. And C is incorrect because SMART objectives are required in a treatment plan, but they should be developed after collaborating with the client and identifying treatment priorities. So, what's being tested with questions like this is your understanding of the treatment planning process, your ability to encourage client collaboration. So, understanding that the treatment plan is done with the client, your understanding of person centered care, meaning you're not doing cookie cutter goals, you're not doing a cookie cutter process. You try to adjust everything to the client's need. And then it's also testing your ability to understand the sequence of treatment planning. The related skill, your ability to collaborate with the client. Question 2. A counselor is developing treatment goals following a comprehensive assessment. Which approach best demonstrates collaboration during treatment planning? A. Prioritize treatment goals based on the client's highest risk clinical concerns. B. Develop treatment goals that balance assessment findings with the client's priorities. C. Establish treatment goals using evidence-based practices and agency standards. Or D. Select treatment goals that address the client's diagnosis and functional impairments. Which of these answers best demonstrates collaboration? Keyword collaboration. Okay. Okay. Do I see a B? I see a D. Okay. The correct answer is B. Collaborative treatment planning integrates both the counselor's clinical judgment and the client's goals, values, preferences, and readiness for change. Assessment findings guide the treatment plan, but the client should actively participate in identifying priorities and developing meaningful goals. A is incorrect because addressing high risk concerns is an important clinical responsibility, but treatment planning should also include the client's input and priorities whenever appropriate. The best example I can think of for something like this is if you have a client who may benefit from inpatient, but they don't have any medical complications or active withdrawal symptoms, and they make the decision to continue with the lower level of care, and their health and safety is not at a place where they're in danger. So you have to work with the client. If they feel like, okay, I want this level, I want to do outpatient counseling, then you work with, you know, that's the best example I can give for that. So you have to consider their preference in that, because it's not an emergency in terms of having a medical or a physical ailment that they have to go. So a lot of times you have to work with the client on what their priority is, what their level of comfort is, what their readiness to change. Remember, a lot of times clients can't just up and go to inpatient, or their schedule can't allow them to do PHP. And so there can be some barriers. So that's why it's important to understand that you're collaborating with the client, and the goal has to match their real life and their readiness to change, and it has to be realistic. All right. C is incorrect, because evidence-based practices and agency standards help guide treatment, but they do not replace the client's participation in developing the individualized goals. And D is incorrect, because goals should address diagnosis and functional impairments, but they should also reflect the client's strengths, preferences, and desired outcomes. Diagnosis alone should not drive the treatment plan. So the knowledge is being tested on a question like this. You're understanding a collaborative treatment planning. So you're always considering the client. Client-centered care. They're also testing your knowledge on clinical reasoning. Are you taking what you know from the assessment and reasoning to make a safe, ethical decision with the client? And also, they're testing your ability, your knowledge of individualized treatment planning. The skill related to answering questions like this is your ability to collaborate with the client. Question 3. A client with a history of complex trauma is participating in treatment planning. The client becomes noticeably withdrawn when discussing past traumatic experiences, but remains engaged in treatment. Which treatment planning approach best supports trauma-informed recovery? A. Prioritize interventions that reduce substance use before addressing trauma-related concerns. B. Develop treatment goals that balance clinical priorities with the client's readiness and sense of safety. C. Focus treatment planning on stabilizing current symptoms before revisiting assessment findings. Or D. Establish treatment goals that address the client's highest risk behaviors before exploring their strengths. Which treatment planning approach best supports trauma-informed recovery? Okay, what do you guys think? B? I see some B's. The correct answer is B. Trauma-informed treatment planning recognizes that recovery is most effective when the client feels safe, has choices, and actively participates in treatment planning. Goals should reflect both the client's assessed needs and their readiness to address trauma. Respecting the client's pace helps build trust and reduces the risk of re-traumatization. A is incorrect, because reducing substance use may be important, but trauma-informed care recognizes that trauma and substance use often influence one another. Treatment planning should not automatically prioritize one while minimizing the other. C is incorrect, because stabilization may be appropriate, but treatment planning should continue to incorporate the assessment findings and the client's preferences. The assessment should guide care throughout treatment rather than be a temporary set aside. And D is incorrect because addressing safety risk is important, but trauma-informed care also emphasizes identifying strengths, resilience, and protective factors. Effective treatment planning balances risk reduction with supporting the client with recovery-oriented goals. All right, so a question like this is testing your knowledge of trauma-informed care. So if you're not familiar with the pillars of trauma-informed care, just review them. They're also testing your knowledge of recovery oriented care. So, understanding what recovery means, how that changes, how that's person centered. So, somebody might think somebody's recovery from a substance may be, I want to have a healthier relationship with alcohol because I want to drink recreationally. Somebody else may see full abstinence from a substance as recovery. They also tested your ability to understand client readiness. You have to consider the stage of change your client is in. And they're also testing your understanding of collaborative treatment planning and prioritizing clinical needs. The skill you need is the skill of developing trauma-informed treatment plans and understanding trauma-informed care. Question 4. Which treatment objective best reflects a measurable SMART objective? A. By 90 days, the client would demonstrate improved communication skills during family sessions as evidenced by counselor observation. B. By 60 days, the client will identify 3 relapse triggers and implement 2 coping strategies in 80% of high-risk situations documented in weekly sessions. C. Within 30 days, the client will increase participation in recovery by attending support meetings and discussing progress while during counseling sessions. And D. Within 45 days, the client will improve emotional regulation by using healthy coping skills when experiencing stress as reported during treatment. So which one best reflects a measurable SMART objective? Okay, what y'all think? Okay, I see a B. I see some B's. I see a C. The correct answer is B. B is best reflects a measurable objective because it has all 5 SMART components. So it's specific. It identifies 3 relapse triggers, or it identifies the goal of identifying 3 relapse triggers and implementing 2 coping skills. It is measurable. So success is defined as 80% of high-risk situations. It's achievable. So it's realistic. It's relevant because it directly supports relapse prevention, and it's time bound. So there's an end date. A is not the best measurable example of a measurable SMART goal or SMART objective because it includes a time frame and an outcome, but improved communication skills is too broad, so it's not specific enough. C is incorrect because it identifies behaviors and a time frame, so they got 2 of the components, but it does not specify how many meetings, how often, or what level of participation would indicate progress. And D is incorrect because the objective identifies a behavior and time frame, but the terms improve emotional regulation and using healthy coping skills are not it's not specific enough. And how do we measure it? Because my perception or my opinion of improved coping skills may be different from the clients, that may be different from somebody else looking at the treatment plan. All right, so this type of question, your knowledge of SMART goals are being tested. So you need to understand what a SMART goal is and what it looks like. You also need to understand what measurable treatment goals and objectives look like. You also need to have understanding of clinical documentation. And the related skill is your ability to develop treatment plan objectives and goals. Question 5. Which approach best reflects current best practices when developing a treatment plan? A. Integrate assessment findings, evidence-based interventions, and identified treatment priorities. B. Integrate assessment findings, clinical judgment, and establish agency practices. C. Integrate assessment findings, clinical judgment, and the client's priorities. Or D. Integrate assessment findings, measurable objectives, and ongoing progress reviews. Which reflects best practices when developing a treatment plan? Okay, so when we talk about best practices in addiction counseling, that means our profession has a standard. So no matter where you're trained, no matter what state you're in, you should be able to go to any of the 50 or 51 states, and everyone should be on the same page about best practices. Now, you may have a different template. You might have a different format at this agency. This state may require extra, but everyone should be on the same page when it comes to best practices in our profession. So that's what I mean. So, like, what are the general rules of our profession, meaning the counseling profession, specifically addiction counseling? All right, let's see what you guys put in the chat. Okay. I see. Let's see what we got here. So what is the best, which answer best reflects current best practices when developing a treatment plan? Okay. I see a B, I see a D, I see a B. So do we integrate findings, evidence-based interventions, and identify? The correct answer is C. Current best practices in addiction counseling emphasize the treatment plan should integrate the assessment findings, clinical judgment, and the client's priority. Treatment planning is a collaborative, person-centered process that reflects the client's strengths, preferences, and readiness for change. All right? So kind of tricky. So none of the other answers are like flat out wrong, but one is the best, and it's C. A is incorrect because evidence-based interventions and treatment priorities are important components of treatment planning, but this option does not include client collaboration. B is incorrect because clinical judgment and your agency standards help ensure quality and consistency of care, but treatment plans should be individualized and based on the client's priorities, not only by the agency practices. And D is incorrect because measurable objectives and progress reviews are important elements of treatment planning, but they occur within the treatment planning process. This option does not emphasize collaboration with the client on developing their goals. A question like this is testing your knowledge of best practices in treatment planning. They're also testing your understanding of collaborative treatment planning. They're also testing your knowledge of person-centered care. And they also would test your knowledge of understanding that the treatment plan is driven by the assessment. Question 6. Which situation best indicates that a treatment plan should be revised? A. The client has achieved one treatment objective and is ready to begin the next objective. B. The counselor identifies additional interventions that may improve treatment outcomes. C. The client reports new barriers that may affect progress towards established goals. Or D. Ongoing assessment identifies changes in the client's functioning, treatment needs, or recovery goals. Which one would indicate that a treatment plan should be changed? Which one best indicates that? Okay. All right. Let's see. The correct answer is D. Ongoing assessment is the primary reason a treatment plan should be changed. As your client progresses through treatment, new information may come up about their functioning, their daily life, their strengths, barriers, or goals. Treatment plans are active living documents that should be updated to reflect these changes. So D is correct. A is incorrect because achieving an objective demonstrates progress and may require a change or a review, but treatment plans should be revised based on ongoing assessment of the client's overall progress and current needs, not because one objective has been completed. B is incorrect because adding interventions may be appropriate at that moment, but treatment plan changes should be based on assessment findings and other clients' changing needs. So you can't base it just on the clinician's preference or clinical judgment. And C is incorrect because new changes and barriers are important and should be explored, but the clinician should first evaluate how those barriers affect the client's functioning and also how it affects their progress and treatment needs. So it has to be assessed because the client may go through a change that doesn't affect their progress or their work towards their goals. Maybe it could be just something that you can just monitor. So, but it doesn't automatically mean that it needs to be changed. A question like this is testing your knowledge of treatment plan reviews and revisions. So they're going to test your ability, or they may test your ability to understand when you can change a treatment plan. So this will fall under treatment planning and documentation. You also may be tested on your knowledge of ongoing assessment. A question like this also falls under your ability to make clinical decisions. The related skill is your ability to review and revise treatment plans by ongoing assessment. So no matter what way this question is asked, you should always remember that the treatment plan can change at any time, and you do this through ongoing assessment and collaboration with the client. Question 7. A counselor is developing a treatment plan for a client diagnosed with alcohol use disorder. Which treatment goal best reflects a realistic and measurable treatment objective? A. The client will strengthen relapse prevention by consistently using healthy coping strategies during recovery. B. The client will identify 3 drinking triggers and use 2 coping strategies in 4 or 5 high-risk situations within 60 days. C. The client will increase recovery supports by participating in counseling and community recovery activities over the next 2 months. Or D. The client will improve alcohol-free decision making by applying relapse prevention skills in daily situations over the next 60 days. So which treatment goal or objective best reflects a realistic and measurable treatment objective? Okay. Okay, I see B. Oh, I see a flood of B's. The correct answer is B. Option B would be the strongest treatment objective because it meets all the components of a SMART objective. So it identifies a specific behavior, it's measurable, it has a realistic time frame, and it also directly targets relapse prevention. A is incorrect because this is an appropriate treatment goal, but consistently is not clear. What is consistent for this particular client? That may vary depending on the client's situation and the client's need. C is incorrect because increasing recovery supports is an important goal, but the objective does not specify how much participation is expected or what success looks like for this particular objective. And D is incorrect because the objective includes a time frame and an appropriate focus, but improved decision making is too broad. So what does it look like for this particular client to improve their decision making? A question like this is testing your knowledge of SMART goals and objectives, your knowledge of treatment planning for alcohol use disorder, and your ability to recognize and to be able to write a measurable treatment goal. The related skill is your ability to develop realistic, measurable treatment objectives. And also the skill of being able to develop treatment planning for specific diagnosis. So if you develop treatment plans with clients, your treatment plan for a client with alcohol use disorder should not be exactly like a treatment plan for opioid use disorder. First of all, because it's person-centered, but also because it has to make sense. It has to be realistic. So what we know about opioid use disorder, opioids are highly addictive. So your goals and your treatment plan should be realistic for what we know clinically about opioid addiction. Question 8. A client is diagnosed with stimulant use disorder moderate following a comprehensive assessment. Which treatment planning approach is most appropriate? A. Develop treatment goals that address stimulant use while incorporating the client's assessed strengths, barriers, and recovery needs. B. Prioritize treatment goals that focus exclusively on achieving stimulant abstinence before addressing other identified concerns. C. Select interventions commonly used for clients with stimulant use disorder to promote treatment consistency. Or D. Base treatment goals primarily on the diagnostic criteria used to establish the client's diagnosis. Which treatment planning approach is most appropriate for a client diagnosed with stimulant use disorder, moderate? Okay, let's see what you guys think. Which one best matches stimulant use disorder? Okay. The correct answer is A. A diagnosis of stimulant use disorder helps guide treatment, but effective treatment planning must also incorporate the client's assessment findings, their strengths, co-occurring concerns, and the stage of change they are in. Treatment plans should always be individualized rather than based solely on the diagnosis. B is incorrect because Abstinence is often an important treatment goal, but effective treatment planning addresses the client's overall functioning, including any co-occurring issues, any medical needs, and any psychosocial concerns. C is incorrect because evidence-based interventions are important, but treatment should be individualized rather than based solely on what is commonly used for that diagnosis. And D is incorrect because diagnostic criteria support diagnosis, but treatment goals should be based on the client's assessment findings, functional impairments, strengths, and recovery priorities. So basically, you can't base the treatment planning solely on the diagnosis, because many people would be considered quote unquote higher functioning, or they don't appear to have severe functional impairment. They don't appear to have them. They may be suffering on the inside or emotionally, but to someone on the outside that does not know about their substance use addiction, their functioning may appear to be normal or not as severe. So you have to consider everything: their level of functioning, their stage of change, their readiness to change. A question like this is testing your knowledge of diagnosis and treatment planning. It's also testing your knowledge of specific diagnosis. The test will also test your knowledge of how to develop individualized treatment planning. So not having a cookie cutter way of thinking when you are supporting your clients, especially with the diagnosis that comes up a lot, which is alcohol use disorder, opioid use disorder, cannabis use disorder, and stimulant use disorder. And they're also assessing your ability to understand the assessment and use the results from the assessment to effectively complete treatment planning with the client. The related skill is your ability to develop individualized treatment plans. So you may see only clients with alcohol use disorder, but guess what? They still should all have different treatment plans because each one has different needs. It may be similar, but it can't be exactly alike because there's so many different components. Question 9. A client has been diagnosed with alcohol use disorder and major depressive disorder following a comprehensive assessment. Which treatment planning approach is most appropriate? A. Prioritize treatment goals according to the client's greatest functional impairment while monitoring both disorders. B. Develop treatment goals that emphasize alcohol recovery before expanding treatment to depressive symptoms. C. Develop an integrated treatment plan that addresses both disorders while prioritizing the client's identified needs. Or D. Select interventions that focus on the primary diagnosis and modify the treatment plan as symptoms improve. Which treatment planning approach is most appropriate? Client has co-occurring disorders, both alcohol use disorder and major depressive disorder. The correct answer is C. So the telltale sign should be the co-occurring disorder. They're diagnosed with a mental health disorder and a substance use disorder. You should automatically say, oh, co-occurring, have to treat at the same time. Now, that does not mean you have to treat both at the same time. You may have to refer out for the mental health part, but if the question asks you that, you should automatically know that the answer is treat both at the same time. Clients with co-occurring disorders should receive integrated treatment plans that addresses both conditions together at the same time. A is incorrect because Prioritizing the most significant impairment is an appropriate clinical strategy, but this answer emphasizes prioritization rather than developing a single integrated plan. So we don't, in addiction counseling, co-occurring is always going to be treated together. B is incorrect because alcohol recovery is an important treatment priority, but delaying treatment for depression may interfere with recovery. So these are evidence-based practices. There has been research done. If you try to treat the substance use and not treat the mental health condition, it impacts the progress in substance use, and vice versa. If you try to treat the mental health condition and do not address the mental health diagnosis, the client is negatively impacted. So this is why the standard in our profession is to treat both. And D is incorrect because treatment plans to address both diagnoses from the beginning. Co-occurring, treat together. A question like this is testing your knowledge of co-occurring disorders, integrated treatment planning, your ability to prioritize clinical needs, and whole person treatment. The related skill is your ability to develop integrated treatment plans for clients who have co-occurring disorders. And you know what I always say? Most of our clients have co-occurring issues or diagnosis. What I mean is they may not have an official dual diagnosis or co-occurring diagnosis. However, they may have issues that significantly impact treatment. So they may be at risk for decline in their mental health. So you should address it all together just for better outcomes. Question 9. Which of the following is a fundamental component of developing an individualized treatment plan? A. Prioritizing identified client needs using assessment findings and clinical judgment. B. Establishing measurable goals, objectives, and interventions based on assessment findings. C. Selecting evidence-based interventions that align with the client's identified treatment goals. Or D. Identifying strengths and barriers that may influence treatment engagement and recovery. Which of the following is a fundamental component, like a foundational component, of developing an individualized treatment plan? Okay. So which one is like, you can't have individualized treatment without this? Which one of these? Okay, I see some B's. Let's see. All right, I see B's. You're right. The correct answer is B. An individualized treatment plan is built by translating assessment findings into measurable goals, objectives, and interventions. These components provide a clear roadmap for treatment, guide clinical services, and establish how progress will be monitored and evaluated. A is incorrect because prioritizing client needs is important because it helps determine what should be addressed. However, prioritization alone does not create the treatment plan. The plan must also be measurable, objective, and include interventions. C is incorrect because evidence-based interventions are an essential component of treatment planning, but they are selected after treatment goals and objectives have been established. So the interventions are what we say we're going to do, how we're going to help with our clinical expertise, but that's done after the goals and objectives are established. And D is incorrect because identifying the client's strengths and barriers is an important part of treatment planning. But these findings inform the treatment plan. They are not by themselves the fundamental component. A question like this is testing your knowledge of what a treatment plan is. What is it made of? So if someone was to say, well, what is a treatment plan? You need to know the components of a treatment plan. It's also testing your knowledge, understanding that you are supporting the client with developing a treatment plan from the results of an assessment. They're also testing your knowledge of SMART goals. And the related skill is your ability to develop individualized treatment plans that have SMART goals and includes the client's identified needs. Key takeaways. For treatment planning, you need to understand that the treatment plan is based on the assessment findings. The information you gather tells you what the client's needs are and what the strengths are. Treatment planning is also something you never do alone. It's always a collaboration. So you're always considering the client. Another key takeaway is that a treatment plan is developed through SMART goals. All of your goals and your objectives. So it's a goal and then the objectives under it is SMART, meaning it's specific, it's measurable, it's achievable, it's realistic, and there's a time frame. Another key takeaway is your intervention should be evidence-based, meaning there has been research done, and we have about 5 to 15 evidence-based interventions that you will see come up in our profession, things that have been, researched and tested and known to be effective. And lastly, you should understand how to update and revise treatment plans. All right, guys, we have completed our very first intensive study session. Give yourselves a hand clap, a pat on the back. I'll give myself one too. We did it, guys. Don't forget to like this live stream, this video. Don't forget to make sure, if you're new here, make sure you're subscribed to the channel. This is how we get the algorithm going so we can find other study partners. I don't know if I'm really good at titles and thumbnails. I just do the best I can. And I'm like, our people will find us. We're almost at 3,000 study partners. They will find us. We are finding each other. So I think the best thing we should do is just make sure that we're commenting, watching the videos, make sure you like the videos, and we are doing a good job of finding each other. It's so much to this YouTube stuff, but I think we're doing okay, guys. Our community is growing. Oh, sorry, guys. I thought I paused them. All right. Thank you, guys. I'm going to sit here for like 3 minutes. Thank you. Thank you for joining us. Good night. You guys have a great evening. We had a good focused study session. I love these types of study sessions. So give yourself a chance to kind of reflect on what was difficult for you, what concepts are easy for you, what's most memorable. You guys have a good night. Good night. I will see you guys next Wednesday. Don't forget, every Wednesday in August, we're doing these intensives. And no worries if you have to work, if you have things to do, just catch the playback. If you're here doing the playback and you were here the whole 3 hours in the playback, please comment. So you guys Just reflect on what concepts you think you need to still work on, what video ideas y'all have for me. Again, in September, I'll start back doing the pre-recorded videos. I have to adjust my schedule, make sure I set time aside. But this was good, you guys. Congratulations. All right. Have a good evening. Thank you so much for watching.